So my first question is if you can just tell me a bit about yourself.
Sure. So I was born and raised in Miami. I went to FIU for undergrad, and I'm currently there for medical school. My family is of Cuban background. I am a first generation college graduate and the first person in my family to pursue a career in medicine. And for the past year, or for the past maybe 10 months or so, I've been living in Bethesda to spend my time doing some research at the NIH campus.
And how has it been being an intern in Bethesda for more than one semester? Because usually internships last for a semester and then you go back home.
Right. So this is an external, I guess, program or internship. So it's a year-long program in Bethesda. I've loved my time here. Honestly, I mean, the DMV area has been awesome. It's really nice. People are amazing. Very centrally located. I have the ability to go into DC. You know, every once in a while on the weekends to go out with some friends or have some dinner, and it's been awesome. There's a lot of history, and obviously where I live in Bethesda, I live right on the NIH campus, so I'm surrounded by pretty much the field that I chose to spend the rest of my life in, science and medicine specifically. Physicians and scientists who focus on improving healthcare, health outcomes, and quality of life for patients. So it's been great. Honestly, it's a surreal experience, and it's something I haven't really gotten tired of.
And can you tell me a bit about your program?
Sure. So I'm part of the NIH MRSP program, which stands for the Medical Research Scholars Program. So it's a program where they select and allow around 30 to 50 students from medical, dental, and veterinary schools across the country to come and spend a year on the NIH campus. We live on the NIH campus, and we become part of labs that belong to the NIH, whether it's veterinary and dental or medical. And it could be anything from clinical research to basic science to translational research or clinical trials. So you really have the opportunity to kind of choose from a lot of different choices that are all equally amazing, and also be a part of something that could potentially be very very important and change the entire direction of medicine or of a particular field. So apart from that, we participate on lectures, interactive lectures between the students of the group, and we have seminars with renowned faculty and renowned scientists from the NIH or that have worked at the NIH before. And we have the ability to sit down and really talk to these people and get to know them as a person outside of their, physician or scientific career, and actually just how they are, as well as engage and talk about career planning and how they got to where they're at and how they've been able to have such a significant impact in the fields of science and or medicine.
Well, that's really cool and really interesting. I was reading a bit about it because I know that FIU News covered you when you first accepted. And can you tell me a bit about what projects you've been working on? And do you have like a difference between the fall and spring semester in terms of what you have been working on or what you've been exposed to?
So my project, or my, I guess, area of research has been the same from the fall to now. I work under the mentorship of Dr. Prashant Chiriboina. He's a neurosurgeon here at the NIH. He belongs to the NINDS, the National Institute of Neurological Diseases and Stroke. And within that neurosurgery branch of the NINDS, he runs the neuroendocrine surgery unit. So he's a skull-based neurosurgeon who focuses on pituitary disease primarily, as well as any other disease or tumors or tumor syndromes that affect the base of the skull. So I've been working under his mentorship in his lab, and I have a few projects that I've been currently working on. One of them is understanding the difference between the tumors that cause Cushing's disease and the surrounding pituitary gland. So the pituitary gland is a pea-sized gland in the brain that controls pretty much the body's entire hormonal system, or hormonal, regulation. And that gland gets its orders, or it's regulated by a part of the brain a little bit higher up called the hypothalamus. So what happens in patients with Cushing's disease is that they somehow develop a tumor in that pituitary gland that completely works on itself. It doesn't follow any orders from the brain. It just is constantly producing cortisol, or actually it produces ACTH, which is one hormone that later on goes and causes the body to produce more cortisol, which is a stress hormone. So it pretty much causes people to be in this their body to be in this continuous state of somewhat stress that the body thinks it's in. And the reason it's important is because it ends up causing a high level of morbidity and mortality. People can develop diabetes, they could have heart attacks, strokes, causes cardiovascular disease. It diminishes the immune system, so a lot of the patients actually die from very severe infections, and a host of other issues, as well as psychiatric conditions that it can lead to. So these tumors are very, very small. They're millimeter sized. So sometimes it's very hard to see them on imaging, and sometimes it's very hard to even take them out via surgery. So we're trying to understand a little bit more of what actually happens, or what change happens to these normal cells of this gland, that they then start to kind of grow and produce hormone uncontrollably, and they end up becoming a tumor. So by understanding what the changes are that may happen, we hope to uncover targets or kind of different events that are responsible, that we could hopefully either prevent or reverse or control with medications and different treatment. Then following the same, or within the same group of patients of Cushing's disease, the other thing that we're focusing on is actually what are the clinical characteristics of these patients. We know that they have elevated levels of cortisol and of this other hormone called ACTH, but how early can we detect this, and how soon after surgery or treatment can we determine whether the patient has entered remission or not? That hasn't been answered very well in the past. So one of the unique things actually of being here at the NIH is that we have one of the largest, if not the largest, population of patients with Cushing's disease. So we have a lot of data, and we have the ability to really kind of pick apart all of the values, all of the lab values, all of the clinic visits, all of the images from these patients, and really see what patterns we can pick up to hopefully improve diagnosis, improve care, and improve the ability to offer these patients successful remission after surgery or after radiation or medication, whatever their treatment might be. And a few other projects that we have are regarding Cushing's disease and like imaging per se. So like I had mentioned earlier, these tumors are very, very small. They're very difficult to see, and around 60% of them are actually not seen on the initial imaging. When they get MRI imaging, you actually don't see them. So you sometimes have to go in and actually do surgery, hoping to find it once the surgeon goes in. But sometimes that obviously is not the best route, or it could be more difficult than it should. So in our lab, we've developed pretty much a coil that you can insert intraoperatively when the surgeon has gone in and kind of exposed everything. They're able to insert this coil and redo images of the patient or redo MRIs that gives a much kind of zoomed in and much more enhanced view of the pituitary gland. And they're able to see pretty much if there is a tumor actually and where it is, so that when they go in and actually try to remove it, they don't have to really dig around the gland or disrupt any of the surrounding structures. So that's also going to be a very big, provide a very big impact. Hopefully, it's in a clinical trial right now currently. A few patients have been able to have it used upon successfully, but it's still currently undergoing trials and enrolling patients. And apart from that, more or less, it's all under the same scope of improving diagnosis and care for patients with Cushing's disease through various methods or various other projects that we're currently doing. Yeah, that's pretty much the gist of it. I'm not sure if you want more detail or if that's good enough.
Yeah, I have two follow-up questions. So my first one is,
Sure.
what does your daily routine look like in terms of like you balancing so many different projects and like coming into the lab? Can you describe that for me?
Sure. So currently, in terms of daily routine, it doesn't change much, honestly, whether it's a Monday or Sunday. Since I live on campus, it's pretty easy for me to just come. So I usually start the day, I guess, around maybe 7 o'clock maybe. Sometimes a little bit earlier, sometimes by 7:30, but start around 7 usually, and try to plan out my experiments for the day. The particular experiments that I'll do or the particular project that I'll work on sometimes will change depending on the current data that we've seen, or kind of how just things change that my mentor would ask me to focus a little bit more on something else. But usually I'm in the lab all day. If there's a surgery happening in the morning that I need to go and collect some tumor samples to run some experiments on, then I usually be in the OR around 8:15. I'll be there throughout the surgery, collect the samples, and then kind of come back to lab and start processing those tumor samples for further experiments down the line, whether we're trying to sequence and understand a little bit about the genetics behind it, or if we're going to kind of break down the tissue for protein analysis or whatnot. And that's usually, I guess, the majority of mornings. It's either lab or the OR. Then on Thursday mornings, we do have a weekly 2-hour or so conference within the neurosurgery department. So that usually starts around 8. So I'll be here around 7, plan whatever I need to do during the day. Around 8, I attend the conference, and that goes on to about 10. It's sometimes a mix of journal club or scientific conference from one of the other researchers that they present their work to us or share their findings with us. Or bi-weekly, we would have a tumor board. So it's a larger conference, probably around almost up to 40, 50 people. And it's a collaboration between the NIH and Johns Hopkins, where the neurosurgeons here at the NIH, neuro-oncologists and neuroradiologists, and what else? Pretty much radiation oncology, medical oncology. Everyone meets in one room, and they kind of discuss patients, particularly difficult patients or patients that, for whatever reason, have not been able to enter remission or are undergoing a clinical trial of some sort. And kind of the entire team of all 40 or 50 people discuss the patient and what the best treatment is. And then once that's done, kind of going back to lab, sometimes I will go to clinic around that time after that meeting, and I'll be in clinic around 2 o'clock, maybe 2 p.m. And then lab time, I guess, till whenever I'm done, whether that's 5, 6, 7, 8 o'clock at night, depends on the day. Fridays tend to be a little bit more quiet, pretty much just lab. And then Saturday mornings, the neurosurgery department has a weekly conference in terms of, it's more of like a medical education. So it's a conference for the residents, and they invited me as well. So I'm able to attend those, and it's various discussions or various lectures. Um, Pretty much that's about it. I mean, I think it's more lab than anything.
Okay, and my follow-up was also if you were matched with your mentor in some way, or did you get to pick the research that you're going to be doing? How did that process look like?
So initially, when you apply to this program, you're supposed to share an interest in terms of if you're interested in a particular field or specialty, or I think you can also give a few options. I don't remember, but I I told them I want to do neurosurgery. So when I was brought to interview, I was able to interview with my current advisor. So we have a mentor, which is my scientific mentor, lab mentor, and then we also have an advisor, which is more of like a oversight or overseeing person in career advice. So my advisor is Dr. John Heiss. He's the chair of the neurosurgery department here, and he's also the director of the program. And I was able to interview with him, talk to him, and then he was assigned as my advisor. And then we spoke about the options. And they, the program allows you to pick where you want to go in terms of what you want to do research, even if you don't want to do research within your specialty of choice. So I had the option of doing research with the National Cancer Institute, working with oncologists or working with the people in the imaging department, focusing on better imaging techniques. I chose to want to stay within the neurosurgery department since that's what I'm interested in. That's what I plan to pursue. So I thought it would be the better position for me to combine, both the scientific experience, which is what I came here for, as well as the mentorship and the more clinical aspect of it and career aspect of it. So when that happened, there's a few neurosurgeons here, and I decided to work with my mentor, particularly because I'm interested in skull-based surgery, and that's his background. So I thought that was interesting, and I was able to meet with him, talk to him, and I mean, I think his projects were something that I definitely had an interest in. And I think also just, we kind of connected. I think initially our relationship was pretty easy to forge. So we kind of took it from there. And it's been an amazing experience. I mean, I would love to do it again, honestly.
Yeah, of course. And by any chance, has the pandemic affected any of your work in terms of like
Yes, so it
what you're
definitely
seeing?
has. It actually, unfortunately, like today's actually my last day that I'm allowed to come to lab. So, and I still have probably around 2 months left of the program. So, or month, yeah, around 2 months. So starting after today at, the end of the day, pretty much they're not allowing any more students or scientists or postdocs, no one to be in labs that are considered non-essential at this point. The essential labs are going to be obviously the labs that are actually doing the research on the pandemic, on COVID. So our lab being in the hospital, I guess I didn't explain that earlier, but so the NIH campus is a huge campus, around 80 buildings, and one of the buildings right in the middle, which is the clinical center, is the actual hospital, and it's pretty much half hospital and the other half are also labs, research laboratories. So my lab is actually here in the hospital. Because of that, the fact that we're in the hospital, they don't want anyone that works in the laboratory side to be coming to the hospital unless you're working on the coronavirus research or you're a physician with patients you need to come and care for and whatnot. But all the other labs kind of need to shut down and wait it out to see. So that's definitely affected me because, now a lot of my actual scientific experiments or bench bench experiments pretty much are all at a complete halt. I can't really do them from home. I'm not here. So at this time, most people are transitioning just to data analysis, writing, and if you have clinical projects going on, then you can definitely do those from home, from teleworking and being able to log into the patient records and whatnot. So yeah, it's been a pretty big setback, unfortunately.
I'm sorry to hear that. I know that a lot of interns and their placements have kind of either sent them home or now they're teleworking and not
Right.
really getting the same experience. But I
Yeah,
hope you make the most of it. And my final
definitely.
question is, where do you hope to be in the future? What have you really gotten out of this experience that you're going to carry on with you, hopefully, in your career?
So I think the primary thing for me, I mean, there's been a lot of things that I've learned on so many different aspects. I think, personally, career-wise, just overall knowledge. But I think the biggest thing was coming in, I was definitely interested in having a career as a surgeon scientist or a clinician scientist, where you actually have the ability to not only care for patients, which is the number one priority for me, but also help advance medicine and kind of, push things forward. I thought I wanted to do that, so I kind of was interested in coming in, doing this experience. However, being in this experience, I think has completely solidified that for me, where now I definitely have envisioned a different track, I think, for my career, hopefully, where I definitely want to include more of a not only clinical research aspect, but more of a actual basic science or translational research um, kind of area into my career if possible. So I would actually like the idea of being able to still do bench work or run a lab while still being able to care for patients, which is something very unique that you can really only experience in one of them being here. Um, so I think that's probably been the biggest change where I think my career has been a little bit nudged in one particular way. Um, yeah. And in terms of hoping what I want to hope to be in the future, I hope to continue with my career, be able to fulfill my goals of being, physician I want to be, the surgeon I want to be, and enter the field of neurosurgery.